Hi, this is Dr. Rosenberger with Appalachian Spring Dermatology, and today we're talking about laser and intense pulse light. There's a number of videos in this series, so I encourage you to check them all out. Let's start by talking about lasers. A laser traditionally uses a single wavelength of light, or a nanometer, to treat certain conditions in the skin. So for instance, the laser that we use here in the office is a 1064 nanometer InDiag laser. Lots of fancy terms. But we use this laser to treat hair, for laser hair removal, as well as to treat leg veins and face veins. So again, a laser uses a single wavelength of light to very specifically target something in the skin. Versus intense pulse light uses a number of different wavelengths to treat multiple things all at once. So for instance, this intense pulse light uses wavelengths all the way from 560 to 1200 nanometers, all in a single pulse. By doing that, you can target many things all at once. So it works well for brown and red discoloration. We primarily use it here in the office for treating patients with rosacea who have background redness, but sometimes we also use it for brown discoloration, particularly for those people who their pigmentation is not resolving with traditional topical therapy. So let's get started and you can see how it works. So you can see Misty's laying here very peacefully, and she has her goggles on to protect her eyes. Now, one thing about intense pulse light is it is a very bright flash of light, so that's why we wear goggles, to protect our eyes. So we'll get started. So on this handpiece, the laser, the intense pulse light pulse comes out in a rectangular space. You can see the yellow light here. So I'm just going over her face and lining up these yellow blocks as best as possible. Now, as the patient, you actually can still feel like you're seeing this bright, intense light. And there's a slight little, sort of feels almost like a little snap on your skin, sort of rubber band kind of snap. Obviously, the more intense we turn the intense pulse light up, the more the patient will feel it. And we do our best. Roll your lips in for me to cover the entire face, because it's actually quite quick and simple to do. So even if a patient only has redness on a certain area of their face, or discoloration on a certain area of their face, generally I still try to cover the whole face. There is some anti-aging and collagen-stimulating benefits to doing intense pulse light as well. Generally, we do not recommend it solely for that purpose, because there's so many other ways that it can stimulate collagen that are much more efficient and, to be honest, a little bit less risky. Intense pulse light does have some risk with it, mainly that it can cause some discoloration. But I just told you we're using it to treat discoloration, correct? But if it's not done properly, you can have some increase in pigmentation. The other thing that can happen with intense pulse light, particularly if the patient has had extensive sun exposure that day, is you can have some discoloration and or redness and peeling, which looks quite disturbing to the patient. So we try to make sure that they haven't had intense sun exposure that day. Even in the days prior is nice as well. But even if somebody does have that temporary redness, it resolves and they still get a great result. So that's about all you need to know about intense pulse light. After the procedure, we had her wash her face before the procedure to make sure it was nice and clean. And after the procedure, as with most procedures, we'll have her apply sunscreen prior to leaving the office. Thank you and have a great day.
Call for an appointment today and learn more by going to our website at wvderm.com.